We're good to go?
Yeah, good to go.
Okay. So, hey guys, thank you so much for being here. My topic of presentation for this class is going to be the aesthetic future of orthodontistry. So, the first question I have that I think we should answer and address is, what really is orthodontistry? A lot of us might have actually experienced or had a nice time with an orthodontist as we went through braces and the various types of procedures that they go through to make sure we have a nice smile. So orthodontistry itself is a branch of dentistry, and what it's doing is addressing malocclusions, which is essentially the misalignment of your bite. And so on the surface level, correcting this bite is pretty essential because we do need to ensure that we're able to eat properly. In some cases, malocclusions might also lead to speech impediments. And so that's why addressing that misalignment is pretty key, and it is something that orthodontists aim to do. But beyond that, malocclusions are also really important as they have psychological and social aspects that you do have potential to resolve as a result of correcting the malocclusions. And so if we're looking at the psychological component to this is kind of, in essence, are you content with who you are? A lot of people might find that because of beauty standards today, social media, seeing other people, they may find that, I want to be the best version of myself. And so if that is the case and someone is in the environment where they feel that there is this opportunity to improve their smile, they may feel that orthodontics and correcting this malocclusion is something they want for that purpose. Beyond that, we also have a social component as well. Socially, we are interacting with people all the time, and to some extent, the way we look can determine the outcomes that we have in society. So a really good example of this, I think, for example, could be in the army. Many people end up shaving their heads, and that is a standard in the military. And so you can kind of parallel that to this in this situation. In a more negative light, name calling and being made fun of could also be a social kind of stimulus that leads people to correct their malocclusion and have a better smile. So yeah, those are some components beyond the physical kind of implications of orthodontistry that I think are really important to address. Okay, so I decided to start my research for this component by giving myself a little bit of a background into what orthodontistry really entails. And I thought the perfect place to do that is through the Canadian Dental Association. And so, as I mentioned before, there are a couple of key components that changing teeth orientation or correcting malocclusion can improve. And so the first is function itself, visual appeal of course, and then of course the bite. I think this image is pretty nice. It does a good job of explaining exactly one of the plethora of cases that an orthodontist might see. So this is an overbite. You can see that the teeth are a little bit too far forward, and this is what the healthy bite should be looking like. If you are in a situation where you have an improper bite or a poor bite, you might see improper chewing, you might see a wear down of the teeth, you might see chipping, and even cavities and diseases. So these are all things that might happen as a result of an improper bite. And orthodontists might use a plethora of different procedures. Braces, of course, is one that we are very familiar with. But beyond that, we also have headgear, we have removable appliances, retainers, oral surgery as well in some cases. Okay, so now that we have a little bit of a background, we can kind of get into what does the future of this field really look like. Okay, so I'll do a little bit of a brief recap as to how far we've come in recent years. So that is something you don't really see too often anymore. It is a retainer, but nowadays we've gone into a little bit more of a modernized version of that, which is very, very similar to that. Personally, I think that's one of the greatest things that has been invented. As a high school student who needed a retainer, I thought it was perfect that I could put it in there and it's kind of seamless, you can't really tell, pretty invisible. And the retainer and the evolution of the retainer has been one of these great improvements in orthodontistry and dentistry as a result of our kind of improvements in AI and technology. My research has shown me and told me that as we continue to move forward, 3D applications are really kind of the bread and butter of what's allowing us to create these improvements. And by 3D applications, I mean things like CAD and CAM, and being able to generate 3D images on computers. All these advancements in technology have really helped us render better appliances for people who are in orthodontic care to use. What's interesting is that future studies are really emphasizing that we should actually look more into the materials that are being used for these appliances. That seems to be an area that's kind of being neglected. People are really emphasizing on making better retainers, more accurate retainers, things that are fitting better, and kind of forgetting that we need to ensure that these materials are safe for our actual use. And so biomaterials are actually one area of study that we're hoping to kind of really dive into in the coming years, along with nanotechnology as well. All right, and so now I wanted to kind of get into this slide, and this image actually is not one that I pulled from the internet. This is actually one that I took myself on the LRT. Every time I drive by Southgate Station, I see this poster, which is really, really interesting, and it always sticks in my head. And it makes me think that the marketing that they've done to advertise for teeth whitening is really, really, like, it's really good, because it's stuck in my head, and like, when I was working on this presentation, I'm like, I'm definitely going to include that in my presentation. And the reason I've included it here today is because another big kind of interest moving forward is how deeply dependent this industry is going to be on teleorthodontics or telemarketing and overall social media. And it really emphasizes the big role that social media has in this field and to what extent it can kind of become a business. Because of course we've mentioned the fact that malocclusions can lead to improper bite, and obviously dentistry and orthodontistry does look at patient health in the mouth region. However, there is a point where you think, okay, I can make my teeth even better, I want to improve them beyond what it was already capable of. And that kind of brings ideas of teeth whitening and maybe even getting veneers in. And so that really kind of, I think was something interesting and something I didn't really realize going into this, that how much of an impact teleorthodontics actually has on this business. And this has become pretty big since the post-pandemic because of the fact that the pandemic obviously limited the extent at which people were able to get out and go for treatments like orthodontistry. There were other more pressing matters maybe. And so this is when we really saw teleorthodontics kind of take off. And I will touch on this a little bit later in my presentation as well. So what's really cool is that beyond that, AI and AR and VR actually are being implemented now to offer dental training. And so these are images from the University of Saskatoon where a dentistry student is using like a combination of AR reality and like a physical model to actually learn and practice some of the key skills. And so it is very possible in the future that orthodontic residents may have opportunities to kind of have a lot of their teaching done in AR and VR. And this is really important. I will leave that surprise for later, but it is very important to kind of like, stimulate the most similar environment, obviously, to patient care. CAD and CAM will also serve to be very, very important as well, as this is kind of the foundation for what AI will work on. And I will also touch on that in the coming slides. Okay, so now we can kind of also get into the further significance of AI in this field. I have a brief kind of review of some of the stuff we've learned about in this course, some of the concepts. Machine learning and deep learning, of course, is a very, very important concept. A brief reminder that machine learning is what kind of is used to identify patterns in data sets. And deep learning is those patterns that can get quickly complicated and build on each other. And through deep learning, we can also bring up artificial neural network. And that brings me to what orthodontistry is currently trying to use, which is the convolution neural network, which uses a complicated kind of convolution mathematic it's like a process. And it pairs that with image, sound, and video processing and image classification. And this is huge because a lot of orthodontistry is mapping out the mouth and planning and figuring out what the correct procedure is for the specific patient. And so by using the convolution neural network, this is kind of the approach and the avenue they're taking to be able to assess those images artificially and without kind of like doctor input. We also have a scan on the left side, that's a CBCT, cone beam computed tomography. I've used many of those before in my lengthy orthodontistry procedure, and it does a detailed kind of map of the internal structures of the mouth and kind of beyond. It's used especially if x-rays and intraoral scanners are not sufficient, so it's a little bit more detailed. Okay, so artificial neural networks in orthodontics are really, really key, as I said before, for treatment planning. And the reason for this is because a lot of times orthodontic treatment might, for example, decide to take an avenue where you need to have teeth extractions or teeth removed. And this is a very permanent kind of thing, right? You can't really put that tooth back if it is removed. And so by understanding how artificial neural networks can actually be used to predict if this is a necessity or something that's avoidable is pretty key. And what's really interesting is that 80 to 90% accuracy was actually shown in some of the ANNs that were used. And so they were able to accurately and relatively, I guess, competitively in comparison to orthodontists, dictate when teeth do need to be removed and when they don't, which is pretty interesting and kind of shows the great extent at which that planning procedure, which is a pretty lengthy part, can kind of be replaced by ANNs. So yeah, the treatment plans, again, between patients can vary differently. We have a couple of images here. This is the intraoral scanner I was talking about, a little bit more surface level of a scan, but again, it does help out kind of map the teeth structure in the patient. This is also another image. It's a radiometric cephalogram. It's also one of the images that ANNs are being used, or being given to ANNs to kind of like use as a means to understand what is the correct way to move forward in a procedure. And then yeah, that alongside physician input is going to serve to be very important in the future. And so beyond that, we can also start talking about prosthetics and prosthodontics. And so CAD/CAM is another theme in this case as well. It really proves to be important in helping us understand what really should be input inside of a person's mouth, helps us understand what prosthesis should be selected, coloring tooth shades, and like all that type of good stuff. It's like another avenue that you can take in case you lose teeth. And so I will touch on this a little bit more later towards the end of my presentation, but I thought that was pretty interesting as well, that that's where CAD and CAM have been used. So now that we've kind of gone over a general kind of understanding of what orthodontics kind of expects, I thought it'd be nice to kind of show you guys my own experience and how my personal, I think, bias as a result, as a patient, has kind of dictated the rest of this presentation. So I guess that's a spoiler, that is my teeth. I think this is when I was like 13. And so I had a pretty severe overbite. That's what my orthodontist had told me. And then I went through a pretty lengthy procedure, went through a lot of treatments. I think this was when I was 17. And so I had braces, I had springs, I had expanders, I had all the works. My jaw was also expanded a little bit. And so now I've thankfully gotten to the point where I think I have relatively straighter teeth, especially since those days. And so that brought me to the question, like, my teeth are straight, where can I go from here? And that kind of brings the aesthetic kind of portion of this presentation. So beyond getting your teeth straightened, you can now opt for having your teeth whitened. And we have surface whiteners, which is one example. These are like toothpastes, chewing gums, things that are pretty accessible, we use in our daily, day-to-day use. They kind of help prevent tooth damage, but they should not be used as a substitute for professional cleaning. Beyond that, we also have bleaches, which is kind of what's happening over here. You have like a light-activated therapy that's kind of helping activate that bleaching agent. And this is something that you see really commonly and heavily advertised as well. Touching back on that social media component, I see it a lot with a lot of basketball players, which is usually the people who I'm following. And so it really shows the extent at which this is quickly becoming a business and moving beyond what is really considered like for good health solely. Bleaches use peroxide and they can be used to alter teeth color. The top image is pretty interesting as well. It kind of shows the extent at which we can dictate what is going to seem the most natural, what is going to seem the most aesthetic. And in terms of bleaches, we do have a little bit of subdivision. You can do heat-based bleaching, mouth guards, and toothpastes with bleach as well. So I also wanted to, I wanted to also kind of reflect on the themes that we've already kind of discussed in class and in this course so far, and how it's being applied here. I think as I was researching about how VR and AR is being used in orthodontistry in New Saskatoon, I really kind of remembered exactly what Dr. Shauna had brought for us when we had VR in class. And I think that's very similar to what we can expect in the future, hopefully in orthodontistry residency and even dentistry training. Being able to observe x-rays, radiocephalograms, intraoral scans, all that type of stuff, I feel like that's something that we can very easily see. I also think that throughout this presentation, I was also touching on a lot of the things that Dr. Osmar or Zain had talked about. His framework of AI really helped me understand a lot of the stuff that we had talked about in this presentation. So now we can kind of go towards what the future really looks like. To what extent do we think orthodontics is actually needed? And in the pursuit of this perfect smile, are we kind of branching too far away from dentistry? So these are pretty big questions, I think, and I think they do relate to that whole idea of technological singularity. Personally, I believe that we're getting towards a point where dentistry and taking care of your internal teeth structures and oral health is going to be one thing, and then all the aesthetics behind it will be something completely different, and it'll be something that you can change, kind of like your hairstyle. I can see different teeth structures and different teeth types being in fashion and out of fashion, and being something that you can really easily change and manipulate, whether that be through veneers, permanent implants, retainer-esque kind of products that you can kind of pop in and pop out. Again, I've kind of brought in some images here. So here we have an artist named Liliati, and we have Kendall Jenner. She has a tooth gem, and this is something I've actually seen a lot in high school. But since then, it's kind of fallen, I think, off a little bit in terms of trend. And I don't really see any of my friends anymore who used to have teeth gems have them anymore, which shows another opportunity for where I guess a business can kind of blossom because of social media and that type of influence. The artist above kind of has a full grill that's kind of rainbow colored. Again, shows the extent at which kind of this becomes quickly creative and more for aesthetic appeal rather than actual health implications. I also think that the technological singularity might kind of bring this to a point where, again, like I said, it's like a hairdresser. You can go to a store, buy the implants that you want, and have them modified, put into your teeth, and then change that tomorrow if you feel like having something different. And again, social media will heavily dictate the extent at which people decide to opt for these things. I think that if it suddenly becomes in trend to have different colored teeth or different colored veneers, people will definitely begin to opt for those. Again, I feel like this is very dependent on us resolving those issues with biofilms, because as we start putting more and more artificial products into our teeth and into that mouth environment, we want to make sure that that's safe. And so I think it was a little bit concerning that I kept reading that this area is not being given enough attention. But I think that that is something that, if it is given attention, it will be resolved. So, yeah. Oh, and the last thing I wanted to talk about is the fact that I think, again, orthodontists will be replaced. It'll be more of a supervisory role. ANNs will be able to help us understand the plan for what is the best approach to each person, each case. And then orthodontists or prosthodontists will kind of just be there to communicate that maybe to the patients. And then another very interesting thing that I had thought about was, so now if we're thinking about going towards just an aesthetic appeal, what's to stop us from just completely replacing our teeth and having artificial teeth? And so the University of Texas actually has gone through some experiments and has gotten to the point where they were able to grow parts of a tooth. And so that kind of brings up the idea of, is it possible for us to just produce completely synthetic dentures, get rid of our own teeth, have better teeth in place of that? And so that kind of really, I believe that, I think would be the pinnacle of this kind of field. I feel like this would happen last. But again, because we've grown teeth, technically, I feel like it is something plausible that I can see happening, maybe in 40, 50 years down the line. Yeah, and then people who have kind of gone towards using complete dentures, they have already found that by using AI and ANNs to produce these complete dentures, this has already streamlined the whole process of patient interaction, consultation, and really reduced the amount of time people have spent in appointments. Which is pretty interesting and kind of really just, again, nails home that point that ANNs and AI is really helping orthodontists and prosthodontists reduce that patient care or that planning aspect of their patient interaction and letting them get to the gist of just making sure the smile is nice. Okay, so yeah, that brings us to the end of my presentation. Was there any questions or thoughts?
So there must be genetic and acquired causes of these abnormalities in where the teeth are, right? And another approach then would be to prevent a lot of these things. And there are two ways to think about that, that the genes are fine, but there's something about the general health of the mother and the way the womb is that leads to these things. You can think of oligohydramnios, where there's less fluid in the womb than there should be, and that can probably make it hard for the teeth to develop. So it seems to me that there are bound to be advances in that as well, right? And AI can help with that, and so on. So have you thought at all about that side of it? Not trying to fix what's there, but prevent the abnormalities in the first place. And is anybody doing that, or are there studies on that?
I haven't really thought about that side of things, because I feel like, again, that's kind of separate from what my thought process was for this presentation. My whole thing was kind of when people are trying to go beyond what is needed. I feel like that has its own right for sure of research that needs to be done. But my whole thought process was more so when people are neglecting I guess forgetting about the hygiene part, or I want to make sure I have good oral health, and just moving straight into the fact that I can make this another part of another accessory. I can make this another modification to my body, that type of thing. So
David Pierce, who's taught in this course a lot, but didn't happen to teach this term, is heavily into genetic engineering of everything, including the pain receptors and so on, so that humans wouldn't have any pain at all, just gradients of bliss. But I would think that there are a lot of genetic things about teeth that are also genetically fixable.
Mm-hmm.
What are your thoughts about that? My evolution from last year to this year is that I think that extensive genetic manipulation of future humans doesn't seem like a good idea to me. But
Yeah.
what do you think?
I think that the genetic implications, regardless of if people think it's a good idea or not, it won't bring that same appeal that prosthetics have. No matter how well we can reorganize the way the teeth form and restructure themselves, I feel like no matter what that happens in that regard, people will still want to have a different appeal and still opt for teeth whitening or veneers or something to really produce something that isn't naturally possible or sustainable genetically. I also don't think that that's a good idea. But I guess based on my points, I feel like it's more of a lost cause. It might be more efficient to just prioritize producing artificial products rather than worrying so much about the genetic makeup, because I feel like people are going to opt for these artificial.
Yeah, I think there's just too many unintended consequences. If you change one thing, you may be having the beneficial effect you were looking for, but also a lot of bad effects that you never anticipated.
Yeah.
So what are the other guys think?
Yeah. Any questions?
Any questions? Teeth questions? Yeah. So, okay, well, thank you very much. And so just to kind of